Well, to those of you in the room, welcome. And those of you on Zoom, welcome. Yeah, I'm the chair and professor of the Department of Bioethics and Medical Humanism at the College of Medicine, Phoenix, U of A. And my background is I'm a pediatric intensivist, practiced about 45 years at Phoenix Children's as division chief of critical care, and did my ethics training at Georgetown. I know Father Fitzgerald from Georgetown, so we kind of go way back. So I was a visiting fellow and a visiting scholar at the Center for Clinical Bioethics at Georgetown and the Rose Kennedy Institute of Ethics at Georgetown as well. So I carry two hats, pediatric critical care and medical ethics. And in our college, I bring both of those to the bedside with our students so that they can gain a better understanding of what it means to be a physician at the bedside and how to make those hard decisions when they are faced with having to make those related to the ethical issues with patients. So I was asked today to kind of bring in the topic of medicine after the Holocaust. And one of the reasons that this came about was we have an independent elective that I give once a month. It's a 4-week course for our medical students, our MS3s and 4s who can take this elective medicine after the Holocaust. It's a very robust 4 weeks where we engage in lots of film viewing, discussions. We visit a Holocaust museum here in Phoenix, and we engage in this whole aspect of medicine over the Holocaust. So that's where I'm going to take you today. I'm going to give you an opportunity to kind of see what it means as it relates to the Holocaust and where we're at today in medicine. So one of the things that's been interesting is that some people that I'll identify have brought out a lot of focus. So for example, Elizabeth Kubler-Ross said, science divorced from conscience is a soul death. And so I wonder why we have to look at the Holocaust to bring us into focus with where we're at with our research here in the United States and elsewhere. One of the things that we identified, at least at our College of Medicine, is two students and I did a poll. We did some research with our medical students doing interviews and try to identify how much Holocaust knowledge they have. And to be frank, it was not that much, which is why we put that independent elective together. And so right now, like I mentioned, we have about 3 to 5 students every month taking the elective, and they have grown in their understanding of what the Holocaust has brought to medicine at the bedside. So I'll be taking you through some of the horrors that we are going to be looking at. I will warn you that some of the pictures that I'll be showing you related to the experiments are not going to be very pleasant to look at, but it is what it is. That's real. So let me move forward. This is where we're going to go today. This is our to-do list. I'm going to take us through an exploration of how the Holocaust shaped modern medical ethics. I'm going to ask us to look at the role of Nazi physicians and just who they were and what they were trying to do. And then we're going to move into whether these lessons of the Holocaust really made a difference in medicine today. And I think you're going to be surprised when I show you that we have a significant dark side, especially presenting itself after the Nuremberg trial. So let me kind of start off with this whole concept of the Nuremberg trial. There were 23 German physicians and scientists who were identified. They were brought before the Nuremberg committee, so to speak. They were identified as those who had committed significant atrocities. And they did that between the years of 1933 and 1945. But here's the interesting part about it. The general who oversaw the trial and the whole aspect of where this was going actually made some very strong statements. And I want you to kind of remember this, because this is really going to backfire on us when we look at what happened after the Nuremberg trial was over. He said, Brigadier General Taylor said, the defendants in this case are charged with murders, tortures, atrocities. Victims were essentially slaughtered. There was no informed consent. These Nazi physicians and scientists were murderers, and the population came in basically wholesale lots and were treated worse than animals. And it's very true. And during the Nuremberg trial, this is what came out. And for the most part, a lot of individuals were brought before the the trial and were either found guilty, they were acquitted, or they got away with it. And so 23 defendants, of those 23, 7 got acquitted. 7 were sentenced to death, and 9 were sentenced to prison. And interestingly enough, Mengele and Eichmann, 2 other individuals, kind of got away with not having pretty much anything. Mengele, as I'll see in a little bit, actually left to Argentina and died there. Eichmann escaped to Argentina as well, but the Mossad went and they found him and brought him back, and I'll share with you a little bit more about him. But it's interesting, out of those 23 defendants, 7 were acquitted. 7 were acquitted. And why was that? How did they get away with that? Where was that coming from? Well, an individual by the name of Gebhardt said, look, and this is kind of where the whole tone of this came about. You can go ahead and put us on trial from the law perspective, but there was no medical ethics. You can't give us a judgment based on the medical ethics of what we did or did not do, because there was no medical ethics at that time. So they said, fine, you want to do this? Bring the law, of which there was not that much at that time, and there were no ethics. So this is kind of where they were moving forward, and that's one of the reasons why things moved along fairly quickly with the Nuremberg trial, and who was acquitted and who was sentenced to death, etc. So moving forward, let me share with you Adolf Eichmann. Interestingly enough, if you ever want to watch a documentary, this individual was a scientist, a Nazi SS scientist. He escaped to Argentina, had a false identity. He was captured by the Mossad in 1960. He had a trial in Jerusalem, but the fascinating and disturbing thing about him was that he had this incredible face of like, I don't care. Doesn't matter what you say. What I did was right. And this whole thing of the banality of evil centered around this individual. So if you ever watch this documentary on him, you will notice how distant he was when he was being pressured to admit to what he did. He pretty much said, no, I didn't do anything wrong, even though he did an incredible amount of atrocious things to individuals. In addition, we found that there were a significant number of Nazi experiments that were ongoing. And so let me just take you through some of them. 23 categories of human experiments were ongoing, and I'm just going to take you through some of them. For the most part, across the board, really not for the most part, across the board, all the experiments were done without consent. And they were done in many of the concentration camps. If you ever are interested in doing a little bit more of the Holocaust experience, there's an incredible Holocaust museum here at the Arizona Jewish Historical Society. It's kind of like right around the corner. They have an incredible museum that you can visit. I take our students there in the 3rd week of their elective, and we spent about 3 hours there going through a lot of the stuff that we've talked about. And so here are some of the things that were done during that time. In the beginning, the T4 euthanasia program was what started this whole concept of the Holocaust. At that time, what they were doing was they were identifying those who were considered less worthy from the personhood aspect and said, we don't want them here. So if they were disabled, and there was about 70,000 of them identified, that's when the euthanasia program started. And that was T4. And that set the tone for the whole concept of the Holocaust. If we didn't think that you were worthy of being within our community, there was no reason to keep you. And so that's where it started. So if you can imagine 70,000 disabled individuals were essentially euthanized, I want you to think about what's happening today. And I'm not going to get into the debate, but I will share with you right now that the medical aid in dying community is moving towards embracing those with disabilities, whether they have a life-limiting disease or not, and offering an opportunity for them to engage in self-directed end of life. So we're seeing that movement that's moving forward. So with that in mind, here are some of the other aspects that really came into play. High altitude experiments, those were done in Dachau. What they did is they took victims and they put them in a low pressure chamber. And what they were trying to do is figure out how high could their pilots fly without pressurization before they died. And one of the testimony of the witnesses there said they were pushed to the edge of death. Some foamed at the mouth, others thrashed violently, many never regained consciousness. That was just one of several. Another one was the freezing and hypothermia experiments, and I'm sure that many of you have heard some of these. These were where prisoners were immersed in ice water, exposed to freezing temperatures, and they were looking to see how cold would a person have to be or get to before they died. And what they were trying to do is find what was the right temperature for their soldiers who were in winter environments. And a prosecutor summary said, one man was revived by being placed between two naked women. Others were doused with boiling water. Seawater experiments. Victims were given seawater. They were forced to drink seawater. And what happened is, of course, if you drink a lot of high sodium content, things just don't go well. And many of them became delirious. One wrote, they became delirious from thirst. One drank his own urine. Another chewed his shoes. So these experiments finally, and during the Nuremberg trial, came out with what was actually being seen at the time. Bone muscle nerve experiments. This is where they were just, the Nazi SS physicians were essentially cutting pieces away from limbs, tissue. And one person, a witness, said, they cut into me to take my leg muscle. I screamed, but they kept going. So a lot of this stuff was out there. And interestingly enough, while all of this was going on, unless you were part of the so-called Holocaust, unless you were part of the Nazi regime, the SS, etc., everybody on the outside really didn't know what was going on. A lot of the German population were unaware of what was going on. It wasn't until the liberation where they actually witnessed what was happening during that time of the Holocaust. Sterilization experiments. Claude Claubert did some incredibly atrocious experiments. He sterilized women using x-rays, chemicals, even surgery, without anesthesia. And one person said, I felt burning inside and then I bled for weeks. They told me I could never have children again. And so they were ongoing. So these are just a few of the things that were happening during the Holocaust with the experimentation that was occurring from the Nazi SS physicians. This individual in the middle, Mengele. Mengele is considered probably one of the most atrocious Nazi SS physicians. If you read about him, you will notice that he carries with him an incredible amount of hatred from those who finally learned about him. And he was one who was able to escape to Argentina. He wound up dying in Argentina. The story goes is that he drowned, but the Mossad never found him, not like Eichmann. So he was out there. And what Mengele was known for was his twin experiments. He was really engaged in trying to understand the concept of twinning and twins. So when the prisoners were coming off the trains, the cattle cars, he would stand out there and he would point to the children coming off and he would pull them aside. And if they were twins, he would pull them aside and he would pretty much confiscate them. What he did was the following. He took one twin as the experiment and the other twin as the control. And when the twin that he was experimenting on died, he then sacrificed the control, and he compared. He had an experimental control. And that's what he did. He was also incredibly interested in conjoint twins. He would take twins and he would sew them back to back to see how they would live and they would function, because that's where he was at. And so Mengele did this incredible amount of significant atrocities. And I want you to kind of think about that, because I'm going to take you into the dark side of US history with research. And I'm going to take you into the dark side of children and what we did with and to children after the Holocaust. and a little bit before the Holocaust, what we did to them as well, even though we slapped the hands of individuals like Mengele and others during the Nuremberg trial. There were Jewish physicians, and one of the questions that comes up in the history was, how did the Jewish physicians deal with these issues? And it was fascinating to see that many of the Jewish physicians struggled with what they were being asked to do, but they had significant resilience. And I'm just going to share with you one individual. She was a pediatrician, and she wrote this book, and it's translated in English. I remember nothing more. And she said, what does it mean to be an ethical resistor in medicine? She said, even in the ghetto, I tried to practice medicine as if it were a sacred act. That is how I resisted. And it worked out well. But there were Jewish physicians there, so we need to be aware that that's where they were and what they were being forced to do. But they carried with them a moral sense, an ethical sense that, yes, I need to be who and what I am, and that is a physician to those who come to me for help. So moving forward, there was liberation, and there was significant shock when everybody began to see what was going on, And when it became evident that there was an incredible amount of atrocities occurring, something that needed to be looked at. Now, in the elective that I give, our students watch several films. One is Schindler's List, The Zone of Interest, a bunch of others that really are very powerful in terms of giving you the background and the history of what was going on. The Zone of Interest is an interesting one. It's about a house that's sitting over here, and the commandant, the commandant of the concentration camp is right on this side of the wall, and they live in this house, and the people living in this house have no clue what's going on over here. And Schindler's List is powerful because we were fortunate enough to be introduced to a Holocaust survivor who's a physician, Alex White, who passed away a couple of years ago, but here in Phoenix, we were able to interview him. We have a huge webinar that came out, and he was on Schindler's List. And when you go to that museum, you can actually see his name on the list where he was identified. And the reason that he was saved, essentially, was because he was a glass worker. He worked with glass. And when he came out, when he was liberated, he came to the States. He wound up becoming a physician, and he practiced. He actually joined the service, U.S. Army, and moved forward. So it was just a privilege to be part of his story when we interviewed him. So if you have a chance, you may be able to kind of go through some of those and get a sense of what it really meant to be a Holocaust survivor. Interestingly enough, from him, and our students actually interview the Holocaust survivors that are still living here in Phoenix and in other places. It's absolutely fascinating to me as a critical care physician and an intensivist and an ethicist to hear the answers when we ask them, do you hate? And many of them said, no, we don't hate, because if we hate, we can't live. Can we forgive? Maybe, but we can't forget. And Dr. White, his takeaway was, be a mensch, be kind. As long as you can be kind, you can get through anything. And so that's kind of where we go with what we do with our elective, is just to kind of focus that if you're at the bedside, and you are faced with a hard ethical decision that you have to make with and for your patient, do so with kindness. And I'm sharing with you that that's kind of my Georgetown aspect, from the more virtuous aspect of where we're headed with medical ethics and being at the bedside. But that's really important for us to understand. So our students kind of buy into that, and they understand that that's really what it is. Our students look to patients as who, not necessarily as what they are, who they are as persons. So after the war, the medical community started thinking, we need to kind of think about this a little bit more. We need to think about this in terms of where we're at with our patients. Not necessarily science, but with humanity. And how can we go about doing that? And what's the best way to do that? Well, the best way to do that is to identify what it means to be a physician at the bedside, caring for someone who's coming to you for help and being a servant to them, and being truly foundational in your ethics and your morals. And so when we looked at the Nuremberg trial, here's what came out of it. Well, we had the Nuremberg Code, we had the Helsinki Report, the Belmont Report, and the Protection of the Human Rights Act. Ethics committees came about in IRBs. So all this came out. Did it make a difference? You'll see. Maybe not so fast. And that's where this whole issue of medicine after the Holocaust comes into play. Medical ethics centers around what Leon Kass said. Ethics is not an abstract code. It is a daily choice to protect the dignity of every patient. Nazi physicians never embraced this. And so we see the principles of medical ethics, and I just want to encourage us to, as we go through this, because I'm going to take you now to the dark side of U.S. history. Think about this. Were we really engaged in this? Did we really learn from what was happening during the Holocaust? And as you'll see, maybe we didn't. So what about us? Now, I want to be very clear. I want a disclaimer. The great majority of research being done today is valid. It's legitimate. It's being done ethically and with a moral foundation. But every now and then, some of it falls off the tracks. And the question is, why do we have to wait until it falls off the track to point a finger? Why can't we just prevent those from happening? Why can't we just get to the point where, no, we're not going to let this happen. We need to kind of stay on tune and make sure that that train is always moving in the right direction. So let me take you back. Let me take you back a little bit in history to kind of share with you that we were not as compliant with our care for those who were vulnerable. So even though the Nuremberg trial said, and everybody said, never again, didn't happen. Unethical research didn't end, and my words, it just changes its disguise. We found another way. They found another way to kind of make that work. So here we go. We were pointing our fingers during the Nuremberg trial, saying, nay, you can't do what you've been doing, and we're going to prosecute you, and we're going to kind of get you to the point where you're going to have to admit, and you're going to have to carry the consequences. One of the things that is important for us as physicians, medical professionals, every decision we make at the bedside carries a consequence, and we own it now and forever, and so do our patients. And so if you don't think about that, you're going to wind up moving in the wrong direction. You're going to have a decision that you're going to regret for a long time, and so is your patient. So every decision we make, we need to think about and move in the direction of making sure that it is foundational, it's ethical, it's moral, and it's in the best interest of the patient. So I'm going to take you back in history. We're going to move through the years, and I'm going to take you back to today and show you that things are still happening. So this is a great book, Human Subjects, Research After the Holocaust. So this book kind of goes through in detail many of the research aspects that occurred even after the Holocaust. I think that we need to make sure that we are aware of these, though I would recommend for those of you who are interested in ethics, history, and Holocaust, this may be a good book for you to kind of look at. So let me take you back. Remember pediatrics. 1913, Pennsylvania House of Representatives, they found that 146 children had been inoculated with syphilis through the courtesy of various hospitals. 15 children in St. Vincent's House in Philadelphia had their eyes tested with tuberculin. They became blind. Some of them became blind. And the experimenters, once they were identified, were never punished. They were never punished. But they were doing things that we would think just doesn't make any sense. And they got away with it. Well, let's move forward. 1939. This is called the monster experiment. This is where normal-speaking children were forced to stutter. Why? Because the speech pathologist, Wendell Johnson, wanted to test his theory on the cause of stuttering. So 22 children, and you'll notice that a lot of these experiments that I'm going to share with you center around disabilities or lack of cognition. 1939, 22 children at the Iowa Soldiers Orphans Home were the subject of monster experiment. They were basically forced to not speak normally. If you can imagine how a child was being forced to stutter, if you want to get into the details, probably now is not the time, but it's pretty frightening of how this kind of came about. Well, let's kind of move forward. So we've had the Nuremberg trial, the 1946. Now, the Nuremberg trial is over. Guess what? The United States said, whoa, we need to put together this program called Paperclip. And what they did between 1945 and 1955, they employed 1,600 German scientists. Even though we said, what you did was wrong, we now want you to come over to us. And we want to use your expertise. In fact, one individual, von Braun, never tried, never prosecuted, but he was the one who developed the Nazi V-2 rocket. And guess where he wound up? NASA, the NASA Apollo program. Another individual, Blum, he was acquitted in Nuremberg. He conducted plague experiments while he was at the concentration camps. And he was contracted to work for the U.S. Army Chemical Corps in Project 63 in 1951. So how did we point our fingers over here in the Nuremberg trial saying, you guys, we've got you, but after the Nuremberg trial, we're going to pull some of you in because we need what you have. Well, it doesn't end there. Well, what was happening in the United States were some of the following. The Guatemala STD experiments, 1946 to 48. What time was that? After the Nuremberg trial, right? U.S. researchers, they infected prisoners, sex workers, Guatemala with STDs without consent. And this was funded by the U.S. Public Health Service. I mean, how did we get there? How did we allow that to happen? And patients from the Guatemalan Psychiatric Hospital participated as test subjects, were also included. Moving forward, 1960, how many years after the Nuremberg trial? At the Jewish Chronic Disease Hospital, 1963, 22 debilitated senile patients with no informed consent were injected with live cancer cells. How were they able to do that? Nobody followed along. There's these Helsinki codes and all of that was put in place were never really followed. The principal investigator, as you see there, Chester Southam, he was reprimanded, but guess what? He was later elected to the president of the American Association for Cancer Research. How does that happen? How do you get away with things like that? Well, there's more to come. So Willowbrook, between the 50s and the 72s, mentally disabled children at Willowbrook School, they were deliberately infected with hepatitis. And here's where it came out that it was just not right. Participation in the study was a condition for admission to the institution. What do I mean by that? What was meant there? So during that time, if you had a disabled child, there were no facilities like we have today where you could go for help or where you could put a child into an environment where they would get care. And the waiting list for something like Willowbrook was about 5 years. So the principal investigator said, hey, if you sign the consent for us to go ahead and participate with this experiment, your child can come in tomorrow. It's called coercion, right? It's coercion in medical ethics. And that's what happened. And Saul Krugman, he justified his work basically saying, your child's going to get infected anyway, so let's cut to the chase and get right to it. Let's just do it. And that's what happened. So families were signing, they knew what they were getting into, and their kids were being admitted rather than having to wait 5 years to get into a facility. So again, notice the patients, the subjects that are being identified as being part of the experiments. Fernald School Study, MIT. MIT started doing experimentation on kids, trying to figure out this non-therapeutic nutritional study using radioisotopes. And again, notice, mentally disabled kids. And that's a picture of them before they were enrolled in the study. And they were given these nutritional aspects with radioisotopes to see what would happen. And that's how they turned out. Any of you that like Quaker Oats? If you eat Quaker Oats, this is them. It was Quaker Oats who started working with MIT to deliver the nutritional aspect with radioisotopes to these kids. And the interesting thing is they were working with the Atomic Energy Commission, and we're going to get to that in a minute, because they wanted to see how these children absorb iron, calcium, mineral services. No, remember, this was 1940s and 1950s. When did this finally come out in terms of admitting that what they did was wrong? Not until 1997. When Quaker Oats finally said, yeah, what we did was probably not right. We're going to settle a lawsuit. There were 30 students that were still alive. They were given about $62,000 each for a total of $1.85 million. Not very much. But it took until 1997 to get there. Remember, what about us? This is the dark side. This is after Nuremberg, when we were pointing our fingers at the Nazi physicians. So what about the Vanderbilt study? 1940s, 820 poor pregnant Caucasian women administered tracer doses of radioactive iron. Who helped them with that? Vanderbilt. Vanderbilt, with the Tennessee State Department of Health, funded by PHS. And today, it's been given significant evidence for iron supplements for women. But it was done in an unethical way. What about Tuskegee? I think everyone's familiar with the Tuskegee experiment. This is a 40-year study between 32 and 72 where untreated syphilis in the Negro males was done. The long-term effects of syphilis, called Bad Blood, great Broadway shows, great movies, documentaries on this. Here's the issue with this. Halfway through this study, penicillin was invented. And some of the subjects heard about that and said, why don't you give us penicillin? Because we heard it really works. And they were convinced not to participate with penicillin if they continued with the program, and we would guarantee you several things that you would get. At that time, a Negro male who was a slave, what have you, if they died, they were buried in a potter's field, usually in a potato gunny sack. But they were told that if they participated and continued with the study, they could be buried, and they would be buried in a pine coffin with a marker. There's a lot of coercion there, isn't there? But a lot of stuff moving with dignity. They're not going to refuse that, so they continued. Well, when did that finally get acknowledged? 1974. Interestingly enough, $37,500 was given to each survivor. A lesser sum, $15,000 to the families of the men who had died. They got free medical care, but guess what? The attorney who represented them got $1 million. Every decision we make has a consequence, and we own it now and forever. Lots of decisions being made here as they were moving forward. It wasn't until 1997 when there was a formal apology for the Tuskegee experiment. And it was at that time when the National Bioethics Advisory Commission came into play. One of my mentors, Ed Pellegrino, out of Georgetown, sat on that and played a very important role in moving medical ethics where it is today. So this is where some people are bold and courageous enough to say, hey, bring it. I'm going to do what I want to do. Thomas Rivers, virologist, he wrote in his memoirs, 1967, it's against the law to do many things, but the law winks when a reputable man wants to do scientific experiments. He said, I tested out live yellow fever vaccine right on my ward. It was no secret, and I assure you that the people in the New York City Department of Health knew it was being done. Unless the law winks occasionally, you have no progress in medicine. I mean, very open. Pretty much saying, you can't touch me. You can't touch me. And so I'll go and do whatever I want. So Henrietta Lacks, we know that this was a famous one as well. Her cells were taken without her consent, 1951, and it has been a big issue with commercialization of her cells. Book written, if our own country had treated her with the basic respect, we may not be talking about her cells as a symbol of injustice. So that was done in 1951. That's how many years after the Nuremberg trial that this was happening, where we were saying, you need to have consent forms. You need to have these things in place. MK Ultra. Anybody know about the MK Ultra experiments? 1953, CIA director authorized the MK Ultra program. They were trying to figure out what are they going to do about the Cold War and with spies. And so it wasn't until 1974 when it was exposed that the MK Ultra experiment really happened. The New York Times reported that the CIA had conducted illegal domestic activities. But here's the language. There's the actual document that proved that it was there. This project will include a continuation of the study of the biochemical, neurophysiological, sociological, et cetera, of LSD. 1955, what they said in there, the mind-altering substances that they were going to use will render the indication of hypnosis easier or otherwise enhance its usefulness, and it's a physical method of producing shock and confusion over extended periods of time and capable of surreptitious use. So they were using enhanced interrogation techniques. They wanted to find out how that would work. Well, here are the individuals. The director of the CIA described LSD as dynamite. Hubbard, the spy who became the first Johnny Appleseed of LSD, if you don't think it's amazing, just go ahead and try it. Gottlieb, who ran the ultra-secret MK Ultra program, was absolutely embracing this. Hunter White, he said, he began administering LSD to unwitting American citizens at the behest of the CIA, and he said it was fun, fun, fun. Where else could a red-blooded American lie, kill, cheat, and rape with the sanction of the All-Highest? Does that sound like Nazi SS? Yeah, really. Kind of moving forward with all of that. So, what about Unit 731? You ever heard of Unit 731? Unit 731 was a Japanese biological warfare camp that had Filipinos, prisoners, Chinese prisoners, American prisoners, and they were doing biological warfare. They had about 150 buildings where they used 3 or 4 of those for human dissection. This is at the end of the war. 4,000 incubators for bacterial growth. They were growing about 100 kilos of cholera per month. If you can imagine how much cholera you would need to put in our Phoenix water plant system, it wouldn't even be close to 100 kilograms where you could infect everybody in Phoenix with cholera. I mean, they were doing this. Well, why is this so important? Why is this so important? Well, because what did we do during Nuremberg? We pulled all these Nazi SS physicians in place. We had a trial. But Unit 731 was found at the very end of the war by who? General MacArthur. General MacArthur said, this medical data that you guys are generating is so important that we're going to let you go if you give me the data. And they did. That Japanese director of Unit 731 was never prosecuted. MacArthur said the data is of such importance as to outweigh the crime issue. And what did we do? We spread 18 species of bacteria carrying insects in Korea and China during January and July of 1952 using the data from Unit 731. So, do you see the dark side here? How we're pointing our fingers during the Nuremberg trial and saying, when it's convenient for us, this is what we'll do, but when it's inconvenient for us, this is where we're going to blame everybody else. What about radiation experiments? In case you didn't know, there were about 4,000 controversial radiation experiments between the 40s and the 70s done by the Atomic Energy Commission. Tens of thousands of subjects. And this really didn't come out until about 1993 when a whistleblower, Eileen Wilson, published it. She wrote a book about 6 years later, and it's called The Plutonium Experiment. And she identified 3 individuals. Elmer Allen was a 34-year-old African-American. He broke his leg, brought to UCSF, and they injected him with plutonium in 1947. And don't ask why. No one really knows. He wasn't told the true reason. Years later, the way they found out, his daughter discovered the details of the experiment only after the government declassified the records. Albert Stevens, he was a house painter, misdiagnosed with terminal cancer. Without his knowledge, injected with plutonium in 1945. to study how radioactive element moved through the body. He never had cancer. He lived another 20 years carrying one of the highest known internal plutonium burdens of any human. He never consented, was never told, and died unaware of what had been done to him. And then Ida Charlton, she was at the University of Rochester Hospital. She was injected with radioactive isotope uranium as part of a study of how the body absorbs and excretes it. She was told as part of her treatment, but wasn't informed of the risk. There was no really true informed consent. And notice that disabled individuals were targeted. The justification given was that she was already seriously ill, so why not? Why not? Well, they had a lot of other aspects, and it's still happening today. And I'm just going to wind down now just to share with you that. I've shared with you just a little bit of the history after the Nuremberg trial. Has it stopped? Not necessarily, which is why medicine after the Holocaust is so important to know. In 2001, April 4th, Elaine Holden Abel, she was a retired nurse, consumed a glass of orange juice mixed with a dietary supplement for the sake of medical research. This was at Case Western. They were doing some Alzheimer's experiments funded by tobacco industry. She died, and it was considered a tragic human error. But look at this. The Federal Office of Human Research Protections, which kind of fell out of the Nuremberg trial with all those different aspects I showed you, did not interview the hospital staff. They accepted the hospital's internal report, imposed no penalty, closed the case, did not mention the death in its letter of determination. Basically buried it. 2001, Ellen Roach, Johns Hopkins volunteer, was engaged in an experiment with hexamethonium. Informed consent, she did sign one, but it was not complete. The current discussion related to informed consents in medicine today is that informed consent doesn't exist. And I'll be very frank, as a physician, physicians will give just enough information to get the answer we want to get the consent form signed. Unless you have a honest, fully declarative, full disclosure narrative with a patient, you're just looking for that signature on the paper. And so the research team failed to thoroughly review existing literature, had documented potential lung toxicity as far back as the 1950s. But they just went and said, here's what we'd like you to do. Dan Markinson, 2004, University of Minnesota clinical trial testing antipsychotic drugs. Now, he had significant mental health issues. Remember who these subjects are being targeted, who's targeting these subjects. He was kept in the trial without fully informed consent. Mother repeatedly raised concerns about his deteriorating condition. He died by suicide during the trial, and very clearly it was noted that there were failures in consent, patient advocacy, and a conflict of interest. And 2013 to 2018, this physician, Anwar, conducted fraudulent clinical trials in Washington State, falsified data, used employees' blood samples instead of actual patient samples, violated ethical standards. He wound up having criminal charges, and he wound up getting into trouble. Well, it's the year 2025. And here we are, January of 2025. University of North Texas Health Science Centers revealed that they used unclaimed bodies as cadavers or sold them without consent from next of kin. This was happening for over 5 years. Desecration of hundreds of corpses, including military veterans. The president resigned following the exposure of these unethical practices. So the big question comes down, how can we prevent things from this continuing? And so here are where we have to decide making the right and best decisions. So I think it's important. What I'm trying to share with you with medicine after the Holocaust is to remember that we have to give some dignity to those who were taken advantage of. That the memory, the medicine after the Holocaust, what I've shared with you just is an incredible memory tool that we need to keep in place as we move forward. And so I have a couple of questions for you all to ponder as you leave here. I have several questions for you. So based on what you know, do you think doctors and scientists should be able to use the data from the Nazi death camp experiments or any other high unethical studies that have come to light? Should we use that data today? Even if we thought that data might save lives. Can we do that? Should we do that even though it was done unethically? How far would you go in using that data? And that's some of the questions that our students engage in when we do this independent elective on medicine after the Holocaust. And we have to debate this. What about this? What about if using the data sets a dangerous precedent, sanctioning unethical human experiments and encouraging similar deplorable acts? Would we, if we did this, would we be considered moral accomplices? How would we react to that? How would we react to that? Where do you go with that? You can debate it either side. Every decision we make has a consequence. We own it now and forever. We have to decide which way we're going to go. So I have a final thought. This is what I want a final thought with you, and this is what I want to leave you with. From my perspective, medicine after the Holocaust is not just history. It's a mirror, and that we either have to face what we see or risk becoming what we fear. It really is the long and short of it. So I hope this has given you some insight into what medicine after the Holocaust is really all about and where we need to move forward in making sure that we address these issues. And I stand by this quote, that unless we face what we're seeing today, the past, moving forward, we're going to have this happen again. Thanks very much. Thanks for listening. I appreciate it.